can also request a copy of the PowerPoint if you'd like. So you will be able to get this later on and refer back to it. Okay, let's talk about the basics. COBRA applies to employers that have more than 20, or actually 20 or more employees, and we're looking at counting full-time equivalents. That means you have to count your part-timers. If you have someone working 20 hours a week, and a normal week would be 40, then that's a 0.5 person, half a person. So you add up all the employees you had, and this applies to the prior calendar year. So if in the prior calendar year you only had 15, then this year you don't have to worry about it. If sometime this year you roll over into the 20 plus category, then that's next year you would have to start complying with that. Now, if you have fewer than 20 employees, there is probably a state law that governs continuation of healthcare coverage after someone leaves. And if you need information on your particular state plan after this webinar is over, please shoot me an email and I'll make sure that I get the specifics of that coverage or law to you in another email. Anybody that's covered under a group health plan that loses coverage due to what we call a qualifying event is entitled to continue that coverage, that same coverage, for a period of time. Here are the five, I think 1, 2, 3, 4, 5, 6 categories. Termination of an employment. Now that could be voluntary or involuntary. Someone leaves the company, they were on your health plan, they're entitled to 18 months of coverage. That is anyone that they have in their family. So let's just say you have an employee, a wife, and 3 kids signed up. All of them have the right to continue their same coverage for 18 months. Reduction of hours. That could be a layoff or someone going from full-time to part-time. They would again lose their coverage because they're no longer qualified to be on your plan. And so they would be entitled to up to 18 months of coverage under the plans that you have offered them. The death of an employee would entitle the family of that employee to 36 months of coverage. Same thing with the divorce. If there is a divorce while the person is employed with you, then the spouse has the right to a 36-month time frame of coverage. Loss of dependent status. Now, we all know that it takes forever to get kicked off a health plan nowadays. You can be 26 years old and still be on your parents' coverage, according to the Affordable Care Act. But when they do lose their dependent status and they're no longer eligible to participate in your plan, then they would have up to 36 months of continuation coverage. And also with Medicare entitlement, that's a little more complicated because while someone's working for you, if you have 20 or more employees, if someone's working for you, your coverage can remain primary. The person does not have to drop your coverage and go on to Medicare, and in fact, it's against the law for you to ask them to do that. So that's another webinar in itself, but if you have any questions about the Medicare side of this, please let me know, and I'll make sure that you get that. There is an 11-month extension available for anyone who is determined to be disabled as far as Social Security goes. That means that they would be receiving a benefit from the Social Security Department and a monthly benefit, and that would entitle them to stay on your plan for another 11 months. Moving on to the deadlines for COBRA. First of all, the plan administrator, which is you, have 14 days to notify the qualified beneficiary. A qualified beneficiary is anyone that had coverage when the coverage was lost. Back to our example, the employee, his spouse, and 3 kids. Each one of those is considered to be a qualified beneficiary. So you have 14 days to notify them. It can all be done in the same letter. You don't have to give them separate letters. You can always send it to the family of the employee. So those are just some things that shorten your number of pieces of paper that you have to send out. So one notice is fine to the family. Once the qualified beneficiaries get your notice, they have 60 days to make an election. And then after that, they have 45 days from the date that they make that election to pay the premiums retroactive to the last day of coverage that they had with you. Do not start their coverage back. Don't reactivate it before you get the check in your hand, because a lot of people float COBRA. They elect COBRA just to have the election in place, and then if they decide they don't need it, they don't pay you. And they've pretty much just given themselves a little bit of a safety blanket for the time frame that they have between one job or another. So why should you care about COBRA? Well, the Department of Labor is a very scary place to me. They have a lot of responsibility for monitoring what goes on in the workplace. And I'm sorry, let's go back to this. The penalties that they can place upon a company are significant. And it can actually include going back and paying the medical claims of someone who's not offered COBRA coverage. Let's just say someone leaves and you forget to tell your vendor that they've gone, or if you're doing it yourself, you forget to send the letter, and that person is in a car accident and they have a significant injury. The first thing the hospital is going to do is, when they find out that they left their job within the last 60 days, they're going to call the employer and ask for the COBRA letter. And if they weren't offered COBRA, then the chances are that you're not going to be able to put them back on your plan if the insurance companies don't like to do that after 60 days. So that would mean that the person had no coverage and that they would be out of pocket for all of their claims for that potential accident that they had. So that means that you, from the court's perspective, would be responsible for paying those claims. The penalties on this COBRA, the COBRA claims against you would be very significant. The last two that I looked at, one was $84,000 and the other one was about $225,000. So these penalties are significant. They're daily and they're by the number of participants on the plan. So it's $100 a day for going back to when you should have offered them COBRA. And if there are 4 people in the family, it's $400 a day. So then there's no limit on that. So it's very important to make sure that you're in compliance. Attorneys play a really key role in this claims business too, because it's easy money. I hope I don't have any attorneys on the line, but if I do, it's part of your job. This is easy money because if there has been a violation, it's pretty easy to prove that there's been a violation. And hospitals know that they're supposed to be offered COBRA, and they get involved in I've had hospitals pay for the COBRA coverage for someone that is in the hospital simply because they want to make sure that they get their money, and they know that without health insurance they won't be able to do that. So anyone can pay for the COBRA coverage, and that includes a hospital or an attorney that might be involved. So just remember, this thing has a lot of teeth in it. It's been around since 1986. Most employees know that they're supposed to be offered this, and all attorneys do, and all hospitals do. So there are a lot of eyes on this. So who's responsible for mistakes that are made? It's absolutely you. And you might say, well, I have a vendor that does it, an outside vendor. You can't assign blame to your COBRA vendor, even if it's in your notice or your agreement with the vendor. They can't take the responsibility because the courts won't allow it. The court will, and the Department of Labor will assign the blame to you, and then it's your responsibility to have at your vendor if you want to go back against them. But it's really important to make sure that your vendor is doing things correctly, and because you cannot assign blame to them. You will be the one that receives the charge, and you'll be the one that has to go to court. So let's talk about those 5 things that you may not know. there's probably 10 or 12, and I'm going to go over 5 of them, but the 5 most important things, I think, one of them that a lot of companies don't realize is that COBRA applies to all of the plans, pretty much all the plans that you offer, except life insurance and disability. So your medical, your dental, your vision, if you have a medical flexible spending account, those are COBRA eligible. So are your health reimbursement accounts. Those are the 2 that normally get missed. So the medical FSA is kind of tricky, and if you want the rules on that, please just shoot me an email and I'll let you know. But bottom line, if somebody has put money in the account, their own money, and they have their money still sitting there, then you have to offer them COBRA so that they can get their money out. The HRA is also something that you attach to your health plan when you offer COBRA. You can charge a separate rate for it, but it does have to be attached. If you have a health reimbursement account for your active employees, you have to offer it to your employees that are leaving the plan. And in some cases, an employee assistance plan or a wellness program, an on-site medical clinic, those kinds of things can be COBRA eligible if they provide medical care. So those are things that you need to keep in mind. This is COBRA applies to all of the following plans. A lot of your vendors, like your health insurance plan, will do your COBRA for free. But just remember and take a look. They normally will only do the medical plan. So if you have dental, vision, and a medical FSA, they're not going to administer your COBRA for those pieces. That means that you have to do that yourself or have someone else do it for you. But don't forget that whoever is doing your COBRA for your medical may not be doing it for the rest of your plans. The second thing that you need to remember is that there are 5 required notices, not just 1. The first one that's, I think, the most important of all is the general or initial notice. This is a notice that you have to give to your employees that sign up for your health plan or your dental plan or any of your other plans that are covered. You have to give them this notice within 90 days of their enrollment in your plan. And that is the Department of Labor regulation. That notice tells the person what their rights are and what their responsibilities are. I call this your get out of jail free card, because if you have given a person this notice and you could prove it, and they come, I'm going to give you an example of this. They are on your plan and they had a baby and they didn't notify you within the 30-day or 60-day time frame that you request in this initial notice, because it's in there what you're waiting or what the time frame is. And they come back and say, and you tell them they can't enroll their child now because they didn't do it in a timely manner. If they come back to you and said, you never told me that and you never mailed me any notice, then you can come back and prove to them that, yes, on this date, we sent this notice to you. And in it said, that your waiting period or the period of time that you had to tell us that you have a baby or add a dependent is 60 days. And it's been 90 days. So you're not obligated at that point to put them on your plan. That's important because your health insurance plan probably won't let you add them if it's more than 60 days, because the health plans in your contracts have rules about when you can add these new dependents. So this is a very important notice. If you have a vendor, check with them and see if they're doing that for you. If you do it yourself, this is something that you need to start doing. It is very, very important and it is required. The second one is your qualifying event notice. We all know that that's the one that gets sent out when someone leaves the company, loses their coverage, and you have to notify them of what coverage they have, what it's going to cost them, and the time frame that they are allowed to continue coverage. The third one is the notice of unavailability of COBRA. This is not sent out that often. This is sent out whenever you are not going to allow the person to have COBRA because they were terminated for gross misconduct. That's a very, very tricky, this is a very, very tricky piece, so be very careful of not offering COBRA, because let's just say that someone comes in and shoots the boss and you don't want to offer them COBRA coverage because they committed gross misconduct. Well, they may have a family, that wife and 3 kids. They did not do what he did, and so in the courts they've found that the family still has those rights, and maybe not the employee because he's going to jail, but the other family members would have the right to continue. So I'd be very careful about that. The other time that you would send this out is that if you someone is moving to Europe and your coverage doesn't work in Europe, you don't have any out of the country Europe coverage, so you would just send them a letter that says COBRA is not available to you. Notice of early termination of COBRA. This is when somebody elects COBRA and you're going to cut their coverage off early. Usually that happens when they stop paying, but you do have to send them a notice if they stop paying to tell them that you're terminating their coverage due to non-payment of premium. The other thing is that maybe they're on a disability, that 11-month extension, and they're no longer disabled. So you would send them a notice of early termination to let them know that their coverage was going to end. Notice of insignificant underpayment of premiums. This drives COBRA administrators crazy, because if someone underpays their premium by a certain amount and it's very insignificant, you cannot terminate their coverage. You have to give them 30 days to make up the difference, and so in the meantime you can't terminate their coverage, but you would have to send this notice out. There is a model notice for these notices on the Department of Labor's website. If you'd like that information, please email me after the webinar is over and I'll be happy to send that to you. You need to make sure that your vendor is using the approved notice, because there are some vendors out there that have gone to shorter versions of the notice, and it is not acceptable in the courts. So if you use an outside vendor, request the notice that they want you, or that they're currently using for your COBRA participants. The third thing is you're required to use the last known address. And that's very important, because if it goes to the last known address that you have on file from that individual, then and it doesn't get delivered because they moved 3 years ago, then that is their fault and not yours, if you have given them that initial notice that tells them that they have to keep their address updated with you. If they didn't give you their new address, then there's the ball is back in their court. So if you don't update the address with your COBRA vendor, if you do this externally, the participant may not be notified. And the courts have ruled that the company is responsible for that. And there have been penalties because of it. The company does bear the burden of the complaint if a COBRA notice was not sent to the person, or it was sent to the person and it came back and that was not the last known address that they had given you, but you didn't update it with the vendor. You can turn around and send another one, but it is up to you to make that right. Number 4, you have to treat everybody the same way. And that's in HR, that's the thing you have to do. Be consistent. Individuals that are on COBRA have the same rights that employees do. So don't forget them during open enrollment. You have to notify them so that they can make changes to their elections at open enrollment. They have the right to, if you have 2 plans, they can change from one to another. They can add dental if they didn't have it before. You have to treat them exactly like you do your employees. And please notify them of the new rates and the plan changes when you notify employees. Often they're forgotten, and 2 months down the road you realize that, oh my gosh, we didn't tell them about the new rates. Well, you can't go back retroactively and make those rates effective 2 months back. You have to make the rates going prospective rates, so you would not be able to collect the difference in the premiums. So make sure you notify them of any changes to the plan, like if you're changing networks or you're changing healthcare coverage, then from Blue Cross to United or whatever, you need to tell them also, because they have to be re-enrolled and elect whatever coverage they want. Number 5, treat family members as individuals. You have to treat all the members of a family as individuals instead of a group. Back to the example of the employee, the spouse, and 3 children, sorry. Each one of them has independent rights to elect. So this employee could elect nothing. The spouse could elect medical and dental, and the 3 children could elect health insurance only. So they each can elect different things, and they can also drop during the year because it's not pre-tax. They can drop their coverage, and they can drop it on just one person if they need to. A child or a spouse can elect coverage without the employee elected. Remember, because they each can elect different coverages, and they stand alone. They are independent from each other. Some other things that you need to remember outside the 5 that I think are critical. Make sure that you look at the postmark date when you're looking at elections. The postmark date is what the Department of Labor looks at when a person elects, and they put that envelope with the election form in the mail. It's the postmark date that starts the clock ticking for the next 45 days for their payment. So every time let's go back to when you mail the form out. The day that you mail the form, that 60 days clock starts to tick that they have to elect the coverage. Don't send your COBRA notices certified. It's not required. It slows down the process. The courts don't like it. All you're required to do is send it first class mail to the last known address. It's cheaper that way. There's no way that they have to go to the post office and pick it up. And this is what is required by the law. Proof of mailing is critical. That's your primary line of defense. If somebody said you didn't mail them a letter or you didn't give them that initial notice, you need to prove that you mailed it to them. And remember, back on the general notice, it is something that you need to mail to the home. Sometimes these general notices are put in your summary plan description, but they're not mailed to the home. So it is something that you need to pay close attention to. But be able to stand up in court and prove that you sent them these notices and you communicated with them on such and such a date, and you terminated their coverage on a certain date. If someone doesn't make a payment by the 1st of the month, you actually have to wait a few days to see if it comes in the first week in the month, because you have to look at the postmark date to see when they mailed the payment in order to cancel it for missing the deadline. It's a pain. You also definitely need to audit your vendor's compliance, because in the bottom line, you're going to pay for their mistakes. And you assume they're doing the right job, you assume that they're using the correct forms, and assumptions do bad things to people, and it can come up and bite you. The other thing that you need to do is make sure that you look at their reports that they send you every month. I worked for a COBRA outsourced vendor for many years, and one of the things that we had such a problem with is that the HR managers and the payroll managers never looked at the reports. So if they forgot to send us someone's request for a notice, or we didn't do what we were supposed to do, we wouldn't know until there was a claim filed. So it's very important for you to look at those monthly reports. And like I said, review those reports that you get for accuracy. It may take a little bit of time out of your day, but in the long run, it could save you a lot of money and a lot of headaches. Okay, does anyone have any questions? The chat is open. The first question is, how can you prove you mailed a notice if it's sent first class and not certified? What we used to do is, let's just say you have several that you're going to mail on the same day, or if it's just one, There is something called a proof of mailing, and you can Google it, or I'll send it to you if you want. It's just a little outline of these letters were mailed on this date to these people. It's a verification. The post office, if you're sending a number of them at one time, will stamp it and certify that you have mailed it that day. So it's just anything, and if you don't do that, make sure that you have a consistent method of documenting when you mail a COBRA notice or when you mail any of the other notices. Anything that you have as far as documentation of those mailings would be would be defensible in court. And I think that second question also was about first-class mail. Proof of mailing is usually what you use. The next question, you say we don't have to reinstate until they pay for the COBRA. I can see that getting sticky if we don't and the person tries to go to the doctor, the insurance denies them, although they've elected COBRA coverage. How do you get around that? Well, the physician's offices pretty much know the COBRA rules, and if they haven't paid for the coverage, then it's not theirs. Yes, you will have someone call and say, I'm at the doctor's office or I'm at the drugstore and they won't give me my prescription because they say I don't have any insurance. Believe me, it happens. The insurance company is going to deny them unless you've reinstated them, but they haven't paid for it yet. So until they pay for it, the law says that you don't have to reinstate their coverage. It is the legal way to go. Wait until they pay and then reinstate their coverage for that period of time. So it is legal to do that. Any other questions? We will put a copy of this. You'll get an email with this PowerPoint attached to it afterwards. Please, my information is on there. If you have any other questions about COBRA or anything that has to do with human resources, I am a free resource to you with your Payentry subscription, so I can answer any of the questions that you may have about any subject that has to do with human resources. Our next webinar that's coming up in April, here's another question. If they have 60 days to elect and then another 45 days to pay, will the time period be lost to reinstate within 75 days? That is a very, very good question, because the insurance carriers don't like to put someone back on the plan more than 60 days out. And they know the COBRA laws, but they will argue with you. That's something where you need to stand your ground. If somebody does drag it out to the last minute, then or the last day, and they have they paid on the 75th day, reinstate them. If you have to argue with the insurance company, which you may have to, it's worth your while to do that because they have to be reinstated. Okay, any more questions? Okay, the next webinar coming up is on conducting a termination meeting, the best practices around that. Please attend if you get a chance. It's already up on our website for you to register. So look forward to speaking by email with any of you afterwards if you have any questions that you want to talk about particular to your company. Thank you for attending today, and we look forward to seeing you next time.